The National Senior Citizens Center (NSCC) says it is working with WHO National Primary Healthcare Development Agency and Nigerian Governors Forum for the inclusion of older persons into integrated healthcare system across the country. NSCC's Director General Dr. Omokaru made this known in an interview with newsmen in Abuja at the sideline of the briefing meeting with Dr. Claudia Mahler, UN independent expert on the enjoyment of all human rights of older persons. According to her, Mahler was in Nigeria to access the country's efforts in strengthening the protection of human rights of older persons and to look at the good practice that could be exported. She explained that the UN expert was also expected to look out for gaps and make recommendations to put the country on the right track to effectively care for older persons. The NSCC boss explained that during Mahler's engagement with stakeholders in Benue, Lagos, Oyo and other states across the country via virtual means, she saw government's commitments to building capacity for human resources, structures and the political will to increase efforts.
When it comes to policy frameworks, Nigeria is on top of it. Because without the policy, the legal, the institutional framework and a dedicated agency, you have not even begun to articulate the challenges. And now, apart from that, now in the area of engagement mechanisms, because you cannot talk about the rights of older persons without talking about their social inclusion and their active participation in what is going on in their concerns. So now we have seen through the efforts of the Federal Ministry of Humanitarian Affairs, in fact, I should give first credit to this present administration, His Excellency President Muhammadu Buhari, who gave us all this framework, and the minister as well, Hajia Sadiya Umar Farouk. Now, talking about now the engagement strategies that NSCC has put in place, her mission is now showcasing the fact that NSCC has been able to form cluster relationships because aging is intersectional, is intersectoral. So all her meetings have been clustered according to thematic areas. Now we have a revised social protection policy. Now we have a bill. I think it has been accepted to social protection bill. Now we have the NDE working with NSCC to develop and mainstream older people into mature people's program and giving loans. It has never happened. Now we have older people mainstreamed into the vulnerable grant for the vulnerable group. She's seen all that. We now have comprehensive stakeholders engagement, which now has included traditional royal fathers. She's seen that. And has included faith-based organization, experts in aging. And she has been able firsthand to talk to all these people. She went to Benue, saw the stakeholders, consultative forum, went to Lagos, the same thing, went to Oyo State, the same thing, and has been able to talk to them across the country via Zoom. So the best efforts of Nigeria is in the momentum that is happening now. NSCC working across, having aging desks and totally including older people even in the National Development Plan. NSCC signing an agreement with the National Primary Healthcare Development Agency. And then Nigerian Governors Forum, the Secretariat, and WHO working together to ensure that integrated care is taken to older persons, integrated in the primary care, that's geriatric care, mainstream in primary care, and then geriatric care now extended to the community through training extension workers.
Similarly, Ms. Moradeke Adelekon, the Foreign Affairs Officer representing the Ministry of Foreign Affairs, said it was gratifying to know that the government was making efforts to address issues affecting older persons.
I'm happy to report to my superiors, and also we would obviously take all this information that we have at hand of at various United Nations engagements to tell the Nigerian story that we, yes, get old in Nigeria, we appreciate our aged persons, and we're willing to lend support to other countries who would like to emulate the good efforts both at the Nigerian government level and at our respective family level.